With more than a dozen victims so far, the death toll from the latest Ebola outbreak has been rising. The hospital handling most of the patients in the Kibale district in western Uganda has also set up isolation rooms for those suspected to have had contact with infected individuals. Ugandan President Yoweri Museveni has urged people to avoid all physical contact to ensure that this highly contagious disease doesn't spread any further.
So I therefore appeal to you to be vigilant, avoid shaking of hands, do not take on burying somebody who has died from symptoms which look like Ebola. Instead, call the health workers to be the ones to do it, and avoid promiscuity, because these sicknesses can also go through sex.
The Ebola virus is remarkably durable and is known to survive in corpses. That's why Ugandan officials have warned against burying Ebola victims. The virus kills more than half those it infects. Public health officials at this point know there are 5 strains of the virus, some more deadly than others. Tariq Yasarovich is a spokesman for the World Health Organization.
As I said, the incubation period is between 2 and 21 days. Stronger the dose of virus received in the body, the shorter this period will be, and the more severe symptoms will be. The symptoms is a high fever, vomiting, sore throat, muscular pain. This is followed sometimes by internal and external bleeding, and then in cases that lead to that, it goes to liver failure and kidney failure.
Scientists don't know the natural habitat of the virus.
We think that it's being transmitted by animals, likely to be by bats, and from bats, primates are being infected, like monkeys or chimpanzees, and hunters who go into forests and kill the animal and eat the animal get infected. And this is where once the virus enters a human, then it's being transmitted human to human.
Experts suspect that in between human outbreaks, the virus lives in bat and monkey populations. The Ugandan Ministry of Health is studying both wild and domestic animals in the area affected by the Ebola outbreak to identify the most likely source. Vidushi Sinha, VOA News, Washington.